Thank you for staying with us. And now to health matters. Nigeria's Attorney-General of the Federation and Minister of Justice, Lateef Fagbemi, has pledged to review the law regarding suicide attempts in the nation, marking a potential shift in policy. The AGF made this promise during a meeting with representatives from the Asido Foundation, a prominent NGO dedicated to mental health advocacy and reforms. In his remarks, Fagbemi noted that the health holds a prime position in President Bola Tinubu's administration's agenda. He highlighted the need to reevaluate the law, especially for those attempting suicide due to mental health issues. Fagbemi noted that support and treatment, not punishment, are crucial for individuals facing such struggles. The Attorney General also promised collaboration with the Health Ministry to address concerns surrounding the Mental Health Act. This move suggests a potential shift towards a more compassionate approach to mental health and suicide prevention in Nigeria. And to talk about this, I'm joined by a mental health expert, Kunle, Pelemo. Good afternoon. Glad to have you join me.
Thank you so much. Good to be here.
All right. Talk to me about why is there this review of the law punishing suicide attempts necessary? Why is this necessary?
Okay. The review of the law is long overdue, and we're glad that it's coming to take shape right now. And the necessity becomes evident when we look at what suicide itself. The punishment that we have been, giving to people who attempted suicide at one point in time or the other had really prevented a lot of people from coming forward to talk about what they are going through. And when we look at it, suicide itself is a complex factor, or it emanates from a complex factor ranging from mental health related issue, mental illness, and some other issues as regards trauma, abuse. And you see that people who go through these are not people to be punished, but they are rather people to be helped. So this particular bill will definitely help in making people willing to come out and speak about what they are going through without any form of being judged or being punished.
Now, aside the review of these, punishments for people struggling with mental health, how do you think the justice system can better support individuals struggling with their mental health?
Yeah, I think this speaks volumes to what the society itself represents and how we view people who are going through mental health related issues, and suicide is one of them. And we've seen how people had been totally abused, both physically, psychologically, and emotionally. So I think the justice system should tend towards even trying to mete out punishment to people who stigmatize people who are having mental health related issues rather than the victim themselves. So by this, it is evident that people who are going through mental health issues will be free to seek for help, will be free to go and also visit professionals who will be there to help them. So this is what I think in that regard will be very vital in solving so many issues as regards suicide and mental health in the community.
If you could just speak a little more on what the impact is. You talked about stigmatization. How does someone who is stigmatized, who is having difficulty or struggling with their mental health, how does this stigmatization affect that individual? And also, what are the potential consequences of punishing individuals for attempted suicide?
Thank you very much. Number one thing is the fact that people who are stigmatized will somehow withdraw themselves from the society. We call it excessive withdrawal or isolation. And in that isolation, it compounds their problem because they feel when they speak up, there will be a stigma attached to them. And then it also prevents people who could have intervened in one way or the other. In other words, where there is going to be an intervention to help them, that will also stop that intervention? Also, how about cases that surrounds data gathering when we talk about mental health and suicide in the society? I mean, the United Nations at a point had said in places like Africa and Asia, we don't have enough data to back up issues surrounding this particular topic we are discussing today. And one of the reasons we don't have such is because there had been stigma attached to suicide, there had been stigma attached to people with mental health issues. So these are some of the reasons why when we abolish such punishment in the society, it will help in all the areas that I mentioned earlier on.
Let me also ask, what's your view on the role the Federal Ministry of Health is playing in addressing mental health issues in Nigeria?
The Federal Ministry of Health has a lot to do. And the first thing that I will speak to is about the budget for mental health. It has to go up. And I think as at the last time I checked, it was about over a little bit over 3% of the budget allocated to health that goes to mental health. And then how about the personnel who discharge duties in regards of mental health in the society? The ratio is about 3 to 100,000 as we speak now. So the Federal Ministry of Health needs to scale up in that regard so that we have a lot of personnel attending to people with mental health issue. And then we also have a way of partnering with private parastatals in order to scale up in that regard as well. And then more importantly is what we are doing today on New Central, which is creating awareness. So the Federal Ministry of Health has to do more in creating awareness about mental health and about suicide prevention on so many platforms so that people will know and people will be aware of their mental health status.
Thank you so much. That's a fine place to wrap up. Thank you so much for your time on the news. Kunle, Pelemo, a mental health expert. Thank you once again.
My pleasure.